Getting sick or dying from something you catch while in the hospital happens more often than you may think. 1.7 million people get infections in hospitals every year, and nearly 100,000 people will die from them. While hospitals have safety measures in place, they can't protect you from what they don't know is a potential threat. Andrew McIntosh shows you how one nurse's discovery could save lives.
This health tip is brought to you by Humana.
Visit our local office in the Pahrump Valley Junction Shopping Center or call 775-727-0871.
They can be lifesavers.
This is how we're breathing for them.
But these resuscitation bags, known as ambu bags, may also be a danger.
Every type of a device has its own set of risks.
If contaminated, the ambu bag can collect bacteria, which could be transmitted to the patient and contribute to the potentially deadly ventilator-associated pneumonia. But safety guidelines for using the bags are vague. The CDC recommends only that they be replaced as needed or when they're visibly soiled.
Well, what may be visibly soiled doesn't necessarily mean that it's not infectious, because you can't see bacteria.
That prompted registered nurse Nikki Resnick to lead a study at the University of Tennessee Medical Center to help establish new safety guidelines.
I followed 147 patients and followed them through the first 7 days of their hospital stay if they were intubated, and I would actually take their actual bag. They would seem clean in appearance, but when we swabbed them, they actually did grow at bacterial growth.
Resnick says there was a 7 to 8% chance of contamination on the first 2 days of using the ambu bag, but that number jumped to nearly 30% by days 5 and 6.
And that's what alarmed us, because a lot of people could be ventilated on a ventilator for, anywhere from 1 to 2 weeks.
Thanks to Resnick's discovery, the hospital now changes the filters on its bags every 4 days. I'm Andrew McIntosh reporting.
Resnick Study, along with other measures, contributed to a 44% drop in ventilator-associated pneumonia cases over the past 2 years at the UT Medical Center. She recently presented her findings to a national conference and hopes they will enhance safety precautions across the country.